Craig Brammer, CEO of the Health Collaborative. We've gathered some of our region's healthcare leaders and frontline workers who are addressing the COVID-19 pandemic together. What makes our region great is our ability to work collaboratively. Our region's hospitals and health systems are here to share an important message that they are safe and they're ready to take care of you and your family. For this event, we'll allow each hospital or health system representative to speak once, and then after everyone has had a chance to make a few comments, we'll take some questions. We've gotten a whole host of questions from folks, and looking forward to a rich dialogue. And to my fellow presenters, just note that we've got a big group here, so we're trying to keep our comments pretty brief. So we're in alphabetical order. We're going to start with Dr. Shafson from Cincinnati Children's. Welcome. Although I don't see him. All right, let's move on. Dr. Jennings, I know you're here, the Christ Hospital Health Network.
Sure. Hey, Craig, thanks. Let me start by thanking the Health Collaborative both for hosting this event and really for all the hard work you all have put in over the past 2 months and really helping all of our systems and public health officials to coordinate our efforts. Frankly, it's been refreshing, I think even inspiring, to see all the healthcare community come together and really share ideas, share protocols, share research, even to the point of being willing to share our staff and our PPE if necessary. So thank you for that. And thank you to all the others on this call and our public health officials. I think the people in our community should really be proud of the collective efforts that we've put into this. I think we should also recognize and thank our community. I think it's fair to say that without the efforts of our citizens who have heeded the advice of Governor DeWine and Dr. Acton relative to social distancing and all those things that have kept us safe, if not for those efforts, we wouldn't be here today talking about how we can safely get back to some degree of normalcy. So thank you to our community for all their work and everything they've put toward these efforts. I think one thing I'd like to reinforce, and I'm not sure it's well known, but you know, for many decades, hospitals have had very good processes in place for dealing with infectious illnesses that come through our doors. We all have a very robust structure that's been in place for a long time. We have committees made up of specialists who are physicians and nurses, epidemiologists, the entire spectrum of individuals whose sole purpose is to treat and track and monitor and prevent the spread of infectious diseases within our walls. So I think the public should be rest assured that this is not new to us. We've been doing this for decades. I think we would also acknowledge that the COVID virus is certainly unique in many ways and certainly has caused and required all of us to put either even greater effort and scrutiny into what we've done. And I think to our collective credit and to the credit of the community, we see numbers in Cincinnati, in greater Cincinnati, and in Ohio that really are the end results of all of our collective efforts, both among the hospitals, the community, and again, that is the only reason that we're allowed to have this conversation moving forward. So it's been about 2 weeks now since Governor DeWine kind of allowed us to get back to taking care of patients with non-urgent, non-emergent conditions. I think our patients, our providers have been extraordinarily patient with this process. And we're all happy to see people coming back slowly, deliberately, in a very safe and deliberate manner. I want to assure everybody that every process that we've put in place from the beginning, including isolating our patients on specific wards, using appropriate PPE, visitor restrictions, everything that has led to the outcome so far is still in place. And in addition, we have new measures in place as well, such as pre-testing many of our patients who come in for elective procedures, such as screening every visitor who comes through our doors, screening all of our employees. There are many even newer safety measures that are now in place to assure the public and to assure our patients that there's never been a safer environment for them to enter for the care that they need and deserve. So I'll just finish with assuring all of us, all of our patients, all of our community, it has never been safer than it is today to enter any of our organizations, through the hospital, through our clinics, through our outpatient testing. Craig, I'm going to steal the tagline on your recent video. We are here, we are safe, and we are ready. Thank you.
Thanks, Mike. And thanks for doing that, because that was my closing line, but whatever. All right, thank you very much. Dr. Kennedy, you are with High Point Health. Can you share a little bit about your perspective, your work?
Yes, thank you. I'm the Chief Medical Officer at High Point Health, and we are a healthcare facility in southeastern Indiana. And I, like Dr. Jennings, we would like to thank the Health Collaborative for your leadership and support through this pandemic. It's been, as he said, a great opportunity to share best practices, and we thank you for that, for supporting us. So thank you. Again, the safety of our patients, our visitors, and our staff are of utmost importance to us, and we follow the CDC recommendations and the Indiana State Department of Health recommendations, and are following a roadmap developed by multiple specialty societies in opening up our services. We're using a tiered approach and prioritize based upon need of the patient. And when we open up, we are going to look a little different. And as Dr. Jennings said, we were doing, screening at the door, universal face mask. Our team members will have their appropriate PPE. We'll have chairs spaced throughout the waiting areas, floor markers for social distancing, extra sanitizing, spot checking to make sure those areas are sanitized appropriately. We're doing, as he said, mentioning separating our COVID patients from the non-COVID patients. We had a special facility built in our ED to help with that. Everyone, the community plays an important role in preventing the spread of the disease, and we just encourage them to continue to do their part in social distancing, wearing their mask, and using telemedicine when their provider feels is appropriate. And again, we would like to and our patients that High Point Health is, just like before the pandemic, a safe place to receive care. And we really don't want patients not to get the care they need for fear of contracting COVID-19. We have an awesome team, and we feel that we'll take great care of you. So just want to reassure the community that we're here and ready to serve. So thank you.
Great. Thanks, Dr. Kennedy. And I see that we have Dr. Shafson here now. Welcome. And wondered if you could just say a few words about your perspective from Cincinnati Children's. Oh, and you're muted.
Thanks, Greg. And as you can see, I'm having some technical difficulties today, so I appreciate the patience. Thanks very much for having us, and thanks to the Health Collaborative for their leadership during this time. At Cincinnati Children's, we've begun a coordinated and comprehensive process to responsibly and gradually reopen. Safety is and has always been our #1 priority, and we're taking every precaution to protect all of our patients, our families, and our employees. We understand parents may have a lot of anxiety about returning to the medical center for care. And as a father and as a pediatrician, I want you to know that every decision we make is being guided by what is best for our children and is based on data to ensure the safety of everyone who comes to our doors. We're implementing plans that are compliant with state orders and informed by our ability to provide appropriate testing and PPE and to practice social distancing, cleaning and disinfection, and universal masking. The collaboration of everyone in this town hall today and our entire tri-state community has made a huge impact on flattening the curve so far. To date, Cincinnati Children's has not had a significant patient need specific to the COVID-19 pandemic, and we've continuously looked for ways to work with and support our healthcare partners throughout the region. Now, while children appear to be less impacted by severe disease than adults, One of the biggest risks to children is not receiving the care that they need. And to meet these needs, we're taking a phased approach to reopening clinical services in neighborhood locations. Together, we're looking to the future, and Cincinnati Children's is at the forefront, leading and driving research and innovation into ways that we can prevent, treat, and recover from COVID-19. This includes resuming our research, education, and related support activities that allow us to continue delivering on our mission to improve child health and achieve the best medical and quality of life outcomes. Everyone at Cincinnati Children's is focused on continuing to educate and inform all those who look to us for guidance during these uncertain times, and most importantly, create an environment where our patients, families, and staff can feel confident that we're taking all steps to ensure their health and safety. So we'll continue to carefully and closely monitor the impact of COVID-19 on our children and our communities, and work collaboratively with our partners to ensure that we're all safe together. Thanks, Greg.
It's awesome. Thanks, Josh. Dr. David O is here with the Hawksworth team, and welcome. Love to hear your perspective on what you guys are working on.
Thank you very much. So at Hawksworth Blood Center, we're actually part of the University of Cincinnati. Many people may not realize that. We provide blood for 31 hospitals in 19 counties in the Cincinnati tri-state area. We have been very active in response to COVID-19 in collecting and distributing convalescent plasma. So this has been a very high demand product that has actually been in high shortage in other parts of the country. We've been very successful and have been able to collect since mid-April and have distributed over 70 units for transfusion at this point, with about as many now currently in inventory. We've actually been so successful that we feel like our inventory is strong enough to be able to help people even outside of the tri-state area here, the region, in other parts of Ohio and Kentucky. We have sent convalescent plasma to almost all of the people on the call today, any that have been interested. They've gone to UC Health, Christ, TriHealth, Mercy, St. Elizabeth's, even High Point Healthcare. And I feel like it's been a tremendous success. Since we have been up in mid-April, we have been able to fill every order from the hospitals that we service in terms of blood components and products related to convalescent plasma. I'd be interested in any comments or questions, but it's been our privilege to be able to provide this product that is really highly desirable at this time to all of our hospitals.
Awesome. Well, listen, on behalf of everybody on this call, let me just say thanks for your leadership and your partnership across the community. Really impressive, really awesome.
Thank you.
All right, so now we have Dr. Jeffrey Weinstein from Kettering Health Network. Good morning.
Good morning. Thanks a lot. My name is Jeff Weinstein. I'm the Chief Quality Officer and an infectious disease specialist here at Kettering Health Network, which includes Fort Hamilton Hospital in Butler County. I want to thank the Health Collaborative for having me as part of this important discussion today about COVID-19 and the safety of our patients across the region. At Kettering Health Network, safety has always been a top priority. We have ongoing procedures that that aid in minimizing risking the chance of hospital-acquired infections. During the COVID-19 pandemic, those protocols were enhanced through updated visitor policies, screening stations at our entrances, more frequent cleaning schedules, and of course, social distancing. We know that alone will not resolve the challenges posed by COVID-19, so testing is also an important part of our strategy. Kettering Health Network has partnered with Kroger Health to open a drive-through testing site at Fort Hamilton Hospital and also several of our hospitals in Montgomery County earlier this month. In just 3 days, the site in Butler County tested about 1,000 patients. In addition to investing in testing, we've also sought the latest treatments for patients. Kettering Medical Center in Kettering, which is our flagship hospital, is participating in the expanded access trial for remdesivir. In addition, we've received a small supply of remdesivir through the DHSS state distribution that occurred this week. All of our hospitals are enrolled in trials of convalescent plasma, as was mentioned by Dr. Ho. and also an IL-6 inhibitor trial so that we can try to provide the best possible outcomes for our patients throughout the region. The safety of our patients and staff remains our top priority during this time. We are continuing to work with the community and the governor as we navigate the COVID-19 pandemic in a way that ensures the people of Southwest Ohio have access to the best possible care. Again, thanks for letting us participate in today's town hall, and I will stay on for any questions that you might have for me at the end.
Excellent. Thank you very much. I'm going to, we've got a few more intros here, and I'm going to ask folks to try to be brief or not redundant of what's already been said, and so that we can quickly get to the question and answer period. So with that, Dr. Johnson is with the Linder Center of Hope. Welcome.
Thank you. Thank you for having me. As Chief Medical Officer for the Linder Center of Hope, a comprehensive mental health center in Mason, we hope community members are monitoring and maintaining their mental wellness during these extraordinary times. The mental health impact of these circumstances will be playing out for some time. When it comes to mental health, we at Linder Center of Hope recommend treating ourselves more gently. We also need to extend that compassion to those around us. We may be physically distanced from others, but we are all in this together. As together we work to fight off this pandemic and take up the challenge of recovering from it, kindness to ourselves and others has never been more important. If you or someone you care about are feeling overwhelmed with emotions like sadness, depression, anxiety, or fear, like you want to harm yourself or others, don't wait to reach out for help. The Linder Center of Hope has maintained the operation of our services with precautions in place to assure your health and safety. We're accepting new and existing patients for hospitalization, for those feeling unsafe or need for a safe environment to stabilize, residential services, to which we recently added a Coping with Crisis 5-day therapeutic restart, outpatient appointments with telehealth options when appropriate to establish treatment with one of our providers for medication management and or psychotherapy, or a more intensive option like our partial hospitalization or intensive outpatient programs. For those people who are coming in person, we are doing temperature screening and screening questions for COVID-19 symptoms. For inpatient residential patients, we are doing testing for COVID-19 symptoms, universal testing. We also have a rapid access service available for those who may benefit from an appointment with a psychiatrist and social worker within a few days of the call. We also have neuromodulation services available, including electroconvulsive therapy, transcranial magnetic stimulation, and esketamine for treatment-resistant diagnoses. Again, monitoring and maintaining mental wellness has never been more important. Thank you.
Thank you, and we're going to be counting on you and your team and your leadership in the months ahead as we all try to figure out this behavioral health, how to do that in this new environment.
Absolutely, thank you.
Great to have you. Let's see, next we have Dr. Steve Fagans, the man with at least 9 full-time jobs. Dr. Fagans, welcome. I know you're here on behalf of Mercy Health, but also appreciate your leadership with the public health sector as well.
Great, thanks so much. I feel like I may be the one that was directed to please hold your comments brief, and so I definitely will, because I know several others. I have the privilege to really be able to see what the Health Collaborative leadership, public health leadership has done. Typically, the Health Collaborative works in the background and does a lot of very important things that people don't really see. They're not at the forefront. And this crisis, among other things, has really shown what the Health Collaborative does, and that's bringing all the health systems together. Every day, 7 o'clock, the last 8 weeks, pretty much the CMOs and the COs have gotten together, have talked, have shared best practices, have standardized our practices so as we open elective surgeries, as we open our visitor policies, as we open our hospitals and emergency departments, we do so together in a more standard way as opposed to each system kind of doing their own thing. One of the things that you see as you come back to the hospitals is you see a lot of masks, and that's a requirement, is that we use universal source control, mask on patient, mask on visitor, mask on us. You see specific units that are COVID units, and you see regular units operating just as they always do, and those are safe and always and continue to be so safe. If you've had a procedure that's been postponed for some time, expect a call, and very likely you will in fact need to have a COVID-19 nasopharyngeal test or oral pharyngeal test prior to that procedure, If negative, we proceed. If positive, we do some other things, and just be aware of that. If it's been more than 30 days, you may have to have an H&P, and know that that can be done virtually. As many of you have probably been already visiting with your physicians through virtual telemedicine and things which will continue. And then finally, I will also just reiterate just the incredible collaboration that the systems have had working together. Craig, he thinks I don't sleep, he doesn't sleep. And so just know that we are very vigilant trying to work together, do the best that we can. And what we've done here locally has been really keep these things on the curve, and we want to keep doing that. Thanks, Craig.
Yep. Thank you, sir. Up next, Dr. Cullen from Premier Health. Welcome.
Thank you. My name is Rob Colon. I am the VP of Quality and Safety for Premier. I'm also the Associate Chief Medical Officer for Miami Valley Hospital. And Premier has numerous hospitals, 5 hospitals in the area, including Atrium Medical Center, which is part of the Health Collaborative. And I can't say enough, like everybody else has, about the importance of that collaborative. What's been very striking is how this entire epidemic has really forced us to come together and has taken that competition away for many of the systems that have been challenging each other for many years, and now have found each other seeking advice from just across the street, sharing knowledge, resources, and as somebody mentioned, PPE in many cases. That's been very, very helpful to see and a refreshing change. As a system, what we've been able to do is continue that collaboration, sharing best practices throughout our different hospitals, and make sure that we have some of those same lessons learned from our different collaboratives that we participate on and integrate them into our system approach to being able to take care of patients. Like many of the facilities that have already been mentioned, we have been using some of the novel therapies, including remdesivir or tocilizumab, as well as the convalescent plasma program. We started using that pretty early in April, and are now well over 35 patients that we have been able to treat at our facilities. Our community blood center has been able to take those lessons learned and share with other community blood centers around the area as well. And we've also been able to support numerous healthcare systems around our community, but they have shipped some of the plasma outside of our area as far away as Wisconsin. So continuing to share from the experience as well as the benefit of the convalescent plasma therapy. One of the things that we have been very fortunate to be able to participate in is expanded testing. As our capabilities for testing have grown, we have now been able to continue to expand. We started our mobile testing capability as far back as March 17th and have now continued to expand the capabilities there, where we have every single day several hundred people that are coming through those facilities being able to get both PCR as well as antibody testing at that location. In many cases, freeing up some of the other healthcare entities to be able to deliver care. What the expanded capability for testing has also allowed us to do is roll that into our opening of outpatient surgical procedures, where we're now doing universal preoperative testing for all of the patients that are coming in for elective cases. And we are rolling that into universal testing within our facilities as well as early as next week. And the goal for this is, of course, being able to increase the safety within our facilities, as it will allow us to much better be able to cohort patients with COVID disease away from those patients who do not have COVID, and another added layer of safety for our patients that come into the facility. I think, like everybody else, we are finding new ways to be able to work in what's becoming the new normal, which is business as new usual, as well as dealing with COVID in the background of every single thing that we do. But again, I think the goal, as everybody has mentioned, is how do we safely return to our new normal, bring patients into the facility, and keep everybody safe. Thank you again for having us in the call.
Terrific. Thanks for joining. Thanks for your partnership. Up next, Karen Colvin, CEO of St. Elizabeth. Good morning, sir. You're on mute.
I know. You think after 100 of these teams, I'd be a little more efficient. Thank you, Craig. I appreciate the opportunity. I'll try to be brief and only talk about stuff that hasn't already been covered. One of the unique things that we've experienced at St. Elizabeth that allowed us to do something a little different is we were able to dedicate one of our facilities. Our Fort Thomas campus was a facility dedicated for 100% of our COVID response. So throughout the system, anywhere, anyone who was either under investigation or positive, we transferred to that facility. And the beauty of that is your infectious disease response team wasn't separated. So you didn't have 3 bodies going to here, 4 bodies going here. Your team was centralized. And it really helped us help give great care and just a great environment. So one of the things that we've started doing in St. Elizabeth is antibody testing. And so we started with several hundred at our Fort Thomas campus. And we found out of 700 tested, only 1 individual tested positive who caught COVID in the community. So what that tells me and should tell this community is that the healthcare workers across this region not only practiced social distancing and good public health inside the hospitals, but they've taken that to their homes and practiced it at home so that when they came back to work, they were COVID-free. So we should applaud all healthcare workers across this region because they've done an amazing job. And hats off, this community should be forever indebted. Thank you.
Great, thanks a lot, Garen. Dr. Strader, you're up, sir.
Good
Welcome.
morning. Thank you. My name is Brian Strader. I'm the president for TriHealth Physician Partners and also the chief medical officer for ambulatory services. I just want to reiterate, like all of my colleagues, how grateful we are for the collaborative nature of the collaborative itself. It's been a huge asset, I think, for the community. And, you know, I think one thing that's worth talking about is that we're going to be a collaborative for many months and years to come. And it's going to be increasingly important in the months as we look forward that we talk to each other, that we're transparent about our resources and also transparent about what we're seeing in our own institutions, because that's how we're going to identify early where there are hot spots and where there are places that we need to respond quickly. So, you know, having these relationships that have been built over the past 8 to 10 weeks, I think is a huge benefit, not just to our own organizations, but to the entire community. So hats off to the collaborative. I really appreciate what you all have done. I would also say that, and I speak for, I'm sure all of my colleagues, that we all feel very grateful that the surge was less of a surge and more of a riplet. And we hope that it continues to be that way. And largely due to the leadership of our state and public officials, I think we're enjoying that benefit. One of the things that we want to focus on and take this opportunity is this is a time to really reach out to patients and really focus on things around access. And I know that some have talked about telehealth earlier. What we're seeing is that there are lots of opportunities in which we can make ourselves more accessible to patients. And that's really what all of what we do is about. And so that's going to be something that we're going to continue to push on, because first and foremost, we want to be safe, but we also want to be appropriate in the care we provide. So I always like to look for silver linings in every event and every crisis, and I think that's one of them. So I'm going to end there. Really appreciate the relationships that have been formed recently and look forward to working with everybody for the betterment of our community. Thank you very much.
Hey, thanks, Brian. Grateful for your partnership and your leadership. So last but not least, Dr. Evie Alessandrini, who, for the personal note, for the past, 8 weeks, is my first meeting early in the morning with Evie and usually my last one late in the day. And Evie, it's been so awesome getting to know you and work with you, and I'm just incredibly grateful for your leadership and partnership.
Thanks, Craig. I really appreciate it. And I can't reiterate enough what everyone has said. We've spent so much time together for the betterment of ourselves. We're all smarter. We have better senses of humor, and the community has really, I think, also benefited from the work that we're doing together. You know, I agree with what everyone has said. I'd just like to add 2 things. An emergency is an emergency. And so if individuals in our community are having symptoms of a stroke or a heart attack, we are here, we are safe, we are ready. We want you to come. We are ready. You've heard what we're doing. I challenge you, though, to participate in that readiness and helping you to keep yourself safe. When you come in, wash your hands, don't touch your face. Hold us accountable. You've heard what we're all doing. We are working on social distancing. We are wearing our masks as source control to keep you safe. We would like you to wear a mask to keep us safe, because we won't be here to take care of you unless we all do those things. Make sure that the providers that are coming to take care of you wash their hands as well, and that they're wearing their PPE appropriately. It's got to be that bi-directional conversation and holding each other accountable so that we get this right. And we're committed to getting it right. And then just lastly, from the UC Health side, we're committed to advancing academic medicine in our community. Have, as Dr. O mentioned, worked really on the collection and distribution of plasma. About 6 or 7 different COVID trials occurring within the system right now, uniquely those that are focused on the sickest patients with COVID who are in the intensive care units on really significant ventilatory support, or even on ECMO, extracorporeal membrane oxygenation, and some really good things on the innovation side. 3D printing of face masks and swabs for testing. And so we just want to reiterate our commitment to advancing new knowledge, because there's not a lot that we know about COVID virus. So look forward to continuing to work together and being here to serve our community well and safely.
Thank you. All right, so we have quite a few questions, and I'm very grateful for all of you who submitted questions. We're all finding our way around Zoom these days, so I'm going to ask for the speaker's assistance with helping me make this quick and efficient. So I'm going to try to ask a question and ask for maybe on average 2 responses. If you want to raise your hand, make it easier for me to see to call on you, make sure you're not on mute if you're going to speak. First question is pretty general. The question is, when a patient visits one of your facilities, what should they expect? We've all seen video of terrible situations in New York City emergency departments, and I fear that some people might get the impression that that's what it's like in a hospital, and certainly that's not the case. But can you tell us a little bit about what patients should expect?
I'm happy to kick that off, Craig, real quickly.
Sure.
If, when possible, as I think Dr. Fagans had mentioned, you're probably going to be communicating with your providers before you come. So don't hesitate to ask questions and be prepared. You're likely to be asked to wear a cloth mask, and individuals will let you know if you need to be tested in advance for COVID virus, perhaps if you're coming for a pre-operative visit or something like that. But when you get here, in most circumstances, you're going to be screened, and someone at the door should be asking you if you've had any symptoms or exposure to COVID. So answer those questions, and then they're likely to take your temperature as well. So just expect all of those things. Remember that they're being done for your safety and benefit, and to participate in those so that we can keep you and ourselves safe.
Anyone else? Yes, sir.
So I think the other thing I would want to relate to the patients is to expect unexpected delays during their stay. I think one of the things that we are seeing now is because of the safety mechanisms that all of our hospitals have developed, it is not necessarily as easy and quick to be moving from one area of the hospital to the other. We need to assess whether we have a COVID status, whether somebody is in a particular isolation. And I think conveying that to the patients is incredibly important. While the hospitals themselves do not look anything, by and large, like we see in New York City with the volumes, we are seeing a little bit of a slowing simply because we have those enhanced protections in place. And I think that's something that for, especially when the last time that they may have come in here, things were moving pretty quickly and efficiently, and most people were not wearing any face covering or masks.
Understood. Great comment. Is there anyone else who wants to jump in here?
Yeah, I'll just mention one thing. So all of those things that are non-COVID related that they were treated before are treated the exactly same now. In fact, we're less busy than we were before COVID, and we may actually be able to provide a little bit more attention. And so all those things, broken bones and heart attacks and other types of heart failures and things, they're treated exactly the same in units that are not COVID units. And so expect that too. You'll see people wearing masks, but that's about the biggest difference.
Great. A related question then is, as hospitals start ramping up surgeries and procedures, how are you all monitoring safety as you expand that those service lines? Can maybe somebody give an example of the kind of metrics? I'm not sure what the questioner was getting into, like literally how do you monitor it, but it's fascinating, might be interesting. Is there an ID, Doc? Josh, go ahead.
Yeah, so great question. So at Cincinnati Children's, we've tried to develop such metrics to ask how are we doing in terms of the gradual recovery, and are we ready to move to another phase, or do we need to stay put or move backwards? And you know, not to get into the gory details, it will involve our use of PPE and our PPE burn rate, because the more people we see, the more employees come back, the more masks and other things we use. It'll be our testing supplies. Again, same thing in terms of providing for the patients. We'll be looking at community illness. So, you know, the governor has announced opening different businesses and then daycares May 31st and pools. We'll all have to watch very closely through the collaborative data what the community prevalence is and compare that to what we're seeing amongst our employees and amongst our patients who are being tested. And then really the last is good old-fashioned leather shoe epi, where we're looking for clusters, we're contact tracing, and we're making sure that we're not seeing small outbreaks or transmission of disease. That's really what we're trying to prevent.
Great. You know, someone mentioned that there's silver linings to look for, and I think one of them is that when I was a kid, I wanted to be an astronaut, and I'm hopeful there are kids now who want to be epidemiologists.
I dreamt of being an epidemiologist. I don't know what you're talking about.
Right. Anyone else want to answer this question?
Yeah, Craig. Yeah, it's Mike.
Mike.
Hey, just a slightly different lens. So at least in our institution on the surgical side, we have a committee of medical staff leadership who literally on a daily basis reviews cases that are being submitted to be done electively. Again, following the governor's guidelines, which include the likelihood that those patients are not going to have to stay overnight. So we have a work group. They meet every day. Each service line puts together the list of patients and procedures that they want approved. And that's kind of how we've progressed on the hospital side. On the office side, we have a similar process. It's a little less, because we have so many sites of care, as is true for everybody on the call, but we are monitoring how many patients are we seeing in person. To Brian's point, trying to leverage virtual visits as well, and really to encourage that, particularly for our most vulnerable patients who we don't want, frankly, leaving their home if they don't have to. So we kind of have a slightly different lens, and I'm sure all the organizations are tracking the volume and the types of patients that they're seeing, whether it's in the hospital or in the offices, to be sure that we're really consistent with what the governor and Dr. Acton has asked us to do, at least in phase 1.
Great. Thanks, Dr. Jennings. And I suspect the average citizen may be unaware of the level of rigor and analysis and effort focused by each of these institutions in monitoring safety data and prevalence data and all that. Every morning, all these teams gather across the country. Yes, sir, Dr. Weinstein.
Yeah, hi. I just want to add a couple other things that I think, of course, all of our hospitals are doing to maintain the safe environment. We always monitor hand hygiene adherence among our healthcare workers, and that's ongoing. And we've seen, as I'm sure others have, actual significant increases in the adherence to hand hygiene policies. And then we also all have infection preventionists who walk the hallways, and they'll be making sure that staff are wearing their masks and following all of the guidelines to keep our patients and their visitors safe.
Great. This next question is very precision focused to one panelist. How can I be a convalescent plasma donor? Let's see, who could answer that? Dr. O.
So thank you for the interest in the question. So we really are trying to concentrate collections of people who have been diagnosed with COVID-19. So typically that's a PCR positive. Now that there is more antibody testing being provided, we can also accept an antibody positive result as well. People should go to hawksworth.org and go to our website, and then one of the very first links will be for convalescent plasma. There's a very short survey there, about 10 questions or less, and then people will be contacted by one of our staff to figure out whether they truly are eligible to donate. So that's the whole step that we have to go through. And we've had over, I believe, 600 people who have submitted information on this website. So it may take some time for us to get back, but we are prioritizing people who have had test positives, and you should be contacted fairly shortly if that's the case.
Awesome, thank you. Here's another precision question. Dr. Johnson, someone asked, what are the signs and symptoms to look for with regard to my mental health during this time?
So most people are going to have some type of mental health symptoms during this time. Life is not normal. We're all stressed out. So many people are anxious. Many people are worried. Many people are nervous. They're not sleeping well. We have bad dreams, vivid dreams, nightmares. So a lot of people, find that they might be drinking more. They're not eating well. They're not exercising. So there's a lot of bad habits. There's a lot of stress-induced symptoms at this time. But what we get concerned about are when those symptoms develop into depression or an anxiety disorder. So you're sad, you're crying, you're irritable, you lose interest in things that you normally enjoy, you're feeling hopeless, you're feeling helpless, you have a lack of energy, you can't concentrate, you can't focus, trouble remembering things, you can't make decisions about things. Of course, very big concern if you have thoughts of dying, you want to hurt yourself. As far as anxiety, significant worry, constant worry, panic attacks, heart racing, sweating, for some people it feels like a heart attack. Other physical symptoms, stomach aches, headaches, some people get rashes, kind of, unexplained physical symptoms that you didn't have before. So these symptoms get worrisome when they impair your daily functioning. You can't attend to your normal demands of life. You can't take care of yourself or the people who depend on you. So when these symptoms get to a point where, you can't do the things that you would normally do for yourself, that's when you need to get help. And so, like I said, most people, because life is not normal anymore, are going to have symptoms of stress and worry. But when they get to a point where you can't do what you would normally do for yourself, that's when it's time to talk to somebody and get some help.
Very good, thank you. And where would people find resources for that to talk to somebody? How do you do that?
Lindner Center is one place. I have to, of course, plug where I work.
Sure.
So the Lindner Center of Hope, you can reach us at 513-536-HOPE, H-O-P-E, or 4673. And of course, there are plenty of other mental health facilities in the greater Cincinnati area that can be reached as well. For people who are feeling suicidal, the National Suicide Prevention Lifeline is another resource. There are lots of national resources that are available. Of course, if someone wants to hurt themselves, they need to get to an emergency department right away. The COVID-19 pandemic should not prevent someone from going to the emergency department if they are unsafe. So that is the most important thing I want to relay. If you are unsafe, you need to get help as soon as possible.
Good, thank you. So this next question is about Matt.
Dr. Jennings had his hand up, it looks like, as well.
Oh, I'm sorry.
Can I just add real quickly? I'm going to put in a shameless plug for primary care.
Yes.
So, I love the Lindner Center of Hope, have referred many patients there. They are a phenomenal resource for our community. But I think for all those listening who have an established relationship with their PCP, please reach out there first.
Yes.
Many of our practices, many of our offices, I would bet every system represented here has resources, including licensed social workers who can provide therapy, who can intervene quickly. And this is one area where I think the video visits are invaluable.
Yes.
And all of us have seen that across all of our organizations. So I couldn't let that go without a plug.
Thank you for saying that. Yes.
Yeah, well said. All right, this next topic is about masks. So 6 months ago, if you were walking down Vine Street with a mask on, you look like a weirdo, a narcissist, paranoid, who knows what. That's changing very quickly. And we are soon going to be at a cultural posture where if you don't wear a mask in public, you look like a weirdo and a narcissist and self-absorbed, because the masks are a sign of solidarity and that we trust each other and that we're in this together, in addition to all the clinical benefits. But this question is open up to the group. Why do I need to wear a mask when going to a hospital? Dr. Strader?
Yeah, I'll take that, Craig, because we've actually been debating this internally at TriHealth, and I'll speak more to the ambulatory side. You know, while you say, and you are correct, it is a sign of solidarity, and I think it's going to become the new normal that people are wearing a mask in the grocery store, when they go to restaurants and so forth, and we'll see how that changes our culture. But there is a segment of our population that don't understand it and actually resist it quite vehemently. And you know, we've had some concerns within our own organization amongst our security department about how do you de-escalate these events, because people, whether right or wrong, feel very strongly about not wearing a mask. And one of the things that we have tried very vigilantly to do is really educate the patient or the visitor as to why we're doing it. The mask isn't for your protection; it's for the protection of the person around you, to prevent droplet spread, et cetera, just from your breath. And what we have found in 99% of the cases is when that is explained, it becomes much more understandable. I think there's a large misconception in the public. The other thing I would say too, at least again on the ambulatory side, there are some patients that can't wear a mask. So for example, patients with significant dementia or autism, or let's say for example, a severe COPD who really feels claustrophobic about having something over your mouth. So we've tried to accommodate that in different ways. But first and foremost, I think the education of the public is going to be key here.
Very good. Dr. Kennedy, can I call on you here? Is it different in the rural parts of the region, do you think, or how are things going there with the masks?
Yeah, I think we haven't had an issue up to patients or visitors not wanting to wear a mask. And to Dr. Strader's point, I think just educating them that, it protects those of you, patients around you and others, I think is what we feel is very important. So I agree with the communication to the public is key.
Yeah, thank you. Anyone else on the mask topic? No, we'll move on. Yes, sir. Dr. Weinstein.
Yeah, I just want to put in from the infectious disease point of view, we actually have data from countries such as South Korea that mask wearing by the general public does reduce the epidemic curve. And I think that it not only protects those around you, which is a great message, but it really probably protects you somewhat as well, because you could touch a surface and with a mask on, you're less likely to inoculate your own mucous membranes. So it's really both for those around you and for you as an individual.
Well said. My understanding is the research is getting even stronger with every passing day about the utility of masking. This next question is a little more business oriented, and it's a good question. What will it look like for vendors, contractors, and others who do business in the health sector to access physicians and medical leadership with all this going on in the background?
I'll jump in and say it looked just like this.
Okay.
We do a lot of video visits.
Yeah.
We'll do more video visits with patients, do more video visits with their colleagues. we meet every day by video, and it works pretty good. So yeah, there will be a lot more technology in use for vendors. I think one big question is, what about those vendors who are necessary in the operating room, necessary for procedures? And so they have to follow the same procedures.
What's the answer?
PPE, right, for PPE, even for testing or other things that our staff follow. And they do need to work through the same process that any vendor does when they come in. So they still will be there. They're part of the staff.
Yeah.
That's definitely the same at UC Health. They're treated just like the rest of the staff, and we all follow the same guidelines as Dr. Fagans mentioned.
Next question, how can members of the public help during this time?
Hey, Craig, this is Garen.
Yeah,
I think for me, the biggest thing that the public can do is kind of something that you've heard 4, 5, 6, 7 times already is if you need care, you need to seek care. You need to assume that as far as healthcare goes, it's status quo and it's safer today than it's ever been. And I believe that as the CEO, and I think our clinicians believe it as well. So you need to seek care, first of all. And then continuing to follow the rules and regulations that are set by either Governor DeWine in Ohio or Governor Beshear in Kentucky, because their heart is in the right place. It's to protect workers, it's to protect people, and it's to prevent as many deaths as possible. So once the full opening is released across both states, probably at the end of the month, and Holcomb and Indiana as well, I think that what we need to do is make sure that we continue to think of others before you think of yourselves. So the people who don't want to wear a mask are only thinking of themselves and that don't tread on me. They're not thinking that they're putting everybody they come in contact at harm's length. And that's a little disappointing, but we'll get through it. But the more people can comply, the better off we are going to be.
Great, thank you. I saw Dr. Shafson.
Yeah, so just to echo a bit of what Garen was saying and to put a pediatric spin on it. So one thing that has actually been published and is very much in the news is that well child care is scheduled and proper child development, vaccination, preventive care, injury avoidance, screening for mental health, screening for obesity, all kinds of things that are really essential to good growth and development in children is being affected by parents not being able to or being concerned about going to their providers. And so I would echo what Dr. Colvin was saying in terms of understanding that this care is essential, it's extremely important, and it's safe to come and to get that care. And together we will work to accommodate either through telemedicine or in person. Can't give a vaccine through telemedicine, sorry kids. I think the other is also to echo what Dr. Coleman was saying, and I think it was Dr. Colonna said, that we're all learning a new normal together. So what this recovery is really about is we've learned what's effective to hold COVID at bay, at least temporarily, in distancing, masking, hand hygiene, disinfection, and now our challenge is going to be to learn how to do those things while getting back to our normal lives, our new normal lives, as Dr. Coleman said.
Yeah. Dr. Cullen, you were going to jump in here, I think.
Yeah, and I appreciate that. That's been the message that we've been trying to deliver. It's our new normal and being flexible and adjusting to it. And when we talk about what our patients and public can do to be able to manage this better, it's to stay informed. And staying informed is going to make sure that we convey to them where to be informed. There's a lot of misinformation and disinformation out there. And I think it's incumbent on all of our healthcare systems to be able to make that information easy for our patients to access. And so we can direct them there. That's also going to be a location for everybody to be able to stay abreast of not just information about the disease, but policies for each facility. There are going to be slight nuances from a patient getting care at one hospital versus the other, or one city versus the other. And the same way that when we're traveling, we'll check whether our flight is on time or not, or where policies are in place at an airport. We may want to start steering our patients to do that before they come to an appointment, before they come to the hospital, so that, back to the original question, they know exactly what to expect before they show up.
Craig, I just like to really quickly add to that. Those are really terrific points, and I think we also have to make sure that for our communities, we're not forgetting those special communication requirements for our vulnerable populations, limited English proficiency, and assuring, and I know we're working on that in many of our groups to make sure that the communication needs are matching the various populations, segments of our population.
Yep.
That's where a lot of the disease is hot spotting now anyway, so it's critically important for us to not lose sight of that.
Yep. Well said. And listen, for our small part in this, the Health Collaborative, we're committed to doing our part to get information out as well, leveraging all the expertise of this group and the many other experts in our community. So you can always, folks can always go to healthcollab.org, and our COVID page is pretty well managed there and updated, and it will have, we translate all of our press releases, I think, into 9 different languages now. And to your point, Evie, and so we hope that's a trusted resource that's helpful to those on the line here.
I was hoping to put in a plug for Hawksworth Blood Center as well. I think there are a lot of people at home who are just looking for something that they can do positive, and blood donation has always been something that I think comes up during times of crisis and challenge. We are asking people to make appointments and not just show up at our donor centers, because we've actually stopped doing blood drives on buses because of social distancing issues. So we face a lot of challenges as we go forward, and now elective surgeries are all ramping back up, and many hospitals are actually at full steam right now. We've been doing a good job and have had blood for everybody so that we can continue going through the other things that people need in terms of healthcare and support not related to COVID-19 and our convalescent plasma efforts there. And so there are lots of challenges for us. So if you're eligible to donate blood, go to hawksworth.org and set up an appointment, and you can help in that way as well.
Great, thank you. I'm going to take the moderator's prerogative and actually throw in an answer to that last question as well before we wrap up here. We're all learning like crazy, right? And if you watch the news or you see Tony Fauci or others, you'll hear about the reproductive coefficient. You might hear it called R0. There's other ways to calculate it, RT, et cetera, but this coefficient is pretty simple to understand. If the number is above 1, it's getting worse. If the number is below 1, it's getting better. That cut and dry. And it's kind of a gift. Very, rarely in your life do you have just one single indicator. If we don't get it below 1, we fail. None of the rest of this matters as a community. And that is not just healthcare's responsibility. That's not just public health's responsibility. That's our entire community's responsibility, the business community and others, to beat that number down below 1. So with that, let me just say again what a huge privilege it is. Uh-oh, Garen's got something.
Yeah, just a real quick one, because I think it's an important issue. I think one of the things healthcare providers are dealing with is what I'm going to say is the herd mentality and the scare mentality. And I think it's very important to know such a small percentage of the positives that you see on every governor's press conference actually make it to the healthcare. So I think some of this fear of coming into the hospitals and the emergency rooms and the behavioral health facilities are all centered around thinking that there's thousands and thousands of patients because of all the positives that you're hearing on the news and in the press conferences. So I think some education on how few of the patients actually need hospitalization would benefit this kind of PR that we're as safe as we've ever been.
Yeah.
Sorry for throwing that into level.
No, you're good. It's a good point. Very good point. All right. Well, let me just say again, on behalf of the Health Collaborative team and our board of directors, we're incredibly honored to be in a support role during all of this, and just humbled by the chance to work with all of you. And I think there's about 250 people involved in all these various committees and work groups, and it's just quite heroic to see all you leaders coming together on behalf of our region. And Mike, I will go ahead and say it. The health system has been working hard to make sure that we're safe, we're here, we're open. I didn't get that right. We're safe, we're here, we're ready. There you go. All right. Thank you all very much. Appreciate your time today. And be safe. Wash your hands. Thank you.